Hey guys, welcome back to the Dental Debrief, where we talk about all things dental. My name is Mahia, this is my best mate Tim, and we run a clinic out of Perth, Western Australia called Azure Dental. So Tim, today I want to talk about specialised dentistry. How would you summarise the different specialties of dentistry?
So I reckon the main sort of specialties that we sort of deal with and the treatments that we do would be orthodontics, straightening teeth, endodontics, which is endo means inside, so treatment inside the tooth, root canal treatments, oral surgery, which is our wisdom teeth extractions and dental implants, and periodontics, which is our gum treatments. We've also got pediatric dentists, and they're super handy. Kids can be tricky customers.
And there's a few other ones as well, right? There's the prosthodontists as well. They make lots of prosthetics and reconstructions. But a lot of these things we do here as well, right?
Exactly, yeah. So you'll find these days general dentists will do much wider array of treatment than what was done in the past. So we find most general dentists doing their own oral surgery and periodontics and endodontics, and using specialists for really tricky, complex cases that are sort of beyond our sort of abilities here and our equipment. And that's when we've got the specialists to refer to.
Cool. So what do you think general dentistry is?
So I think traditionally general dentistry was cleans, fillings, crowns and things like that. But I think as technology has gotten better over the years, more and more of these treatments have become much more simple to do. And that's why we're seeing much more of those treatments done in general practice, I think. Why do you reckon dental specialists exist? Because we just deal with the mouth. You think it's a pretty small area, but even for that area, we've got 7, 8 specialties out there. So why do we have these dentists that just focus on one little area?
Yeah, I remember when I was at the start of dental school, I couldn't believe we're going to spend 5 whole years in this tiny area. But now after training that much, you realize every area has so many techniques and procedures and tools and different equipment needed as well. So over the many years dentistry has been around, these procedures have developed in the complexity, and there's eventually what happens is sometimes someone who does that technique repetitively does it really well, and that's how the specialties kind of evolved. But like you said, it comes down to that training and equipment. Sometimes we just don't have the equipment to do a treatment properly and at a really high level, and that's when we're sent to a specialist.
Exactly. I think the idea that you can do every single case that comes through your door, like unless you're super arrogant, I think everyone knows their limits, and when that limit is reached, that's when we've got the specialist to refer to.
Yeah. So Tim, if you're a dentist starting out, would you recommend picking everything and trying to get good at everything, or picking like a narrow avenue, doing that really well, but then you won't maybe be turning away a lot of patients or referring a lot of patients? What do you think is the best approach?
I think you've got to do what you're interested in. Like if you're interested in it, you're going to be good at it because you're going to put the effort in. And if you're interested in something, it's just way easier to learn. So I think the problem with specialties is there might be procedures within that specialty area that you like, right? So for example, periodontists treat gum disease, and they do cosmetic gum grafting and other cosmetic sort of gum plastic surgery. And you might be a dentist, like for example, treating gum disease has never really been something I'm super interested in, and I know there's people who do it better for me, and that's why the periodontist is there. So we do refer a lot of our sort of complex gum treatment off to the periodontist. But the periodontist also does sort of cosmetic gum procedures, something I love, right? So I think for me personally, to do periodontics and specialise in this one area, if you're not interested in everything in that area, then you're better off being a general dentist and picking parts of that specialty that you like and becoming really, really good at those. I think it's not that you have to be good at everything. You know, you don't have to do everything, but you can pick sort of 4, 5, 6 procedures in dentistry that you're really passionate about. And as a general dentist, if you focus on them, you're going to be amazing at them. When do you reckon, like, where do you draw the line? When do you decide, can I do this procedure or do I refer it to a specialist?
I guess the most important thing is you don't want to be into the procedure and then find out that you're in too deep and then you want to refer the patient. That's a bad look. That's going to cause a lot of stress. So the idea is you want to really know your capabilities early, and that's just to start small and be a bit more patient, do some procedures, do them well. Then once you feel confident, then you move into the next one. Yeah. So the time to refer, I guess, it's really tricky when you're starting because you don't know your limits. But hang on, what is the answer to that?
I mean, it's tricky. Like for me, it's got to be all about, can you manage the complications that come up? So to me, it's like, if I'm going to do a procedure, you've got to think about every potential complication and can you manage that? And if there's complications there that you can't manage, you don't want to do a procedure, have a complication, and then have to refer it off, because that's not fair on the patient. They're gonna say, well, why didn't I just see this person from the get-go? And I think that's fair enough.
That's the best standard of care, right?
Yeah, so the classic one is like, we don't do extractions here on people on osteoporosis medications, Prolia, because there's a very small risk that you can get what we call medication-related osteonecrosis of the jaw. The problem with that is it's a tricky condition to manage, and we're definitely referring to an oral surgeon if it arises. So our attitude is, because that complication is a possibility and we can't manage it, those extractions all go off to the specialist.
And 99% of the time, those extractions will go fine.
Exactly.
But it's just that 1% that we know we can't deal with the mess and the complication that comes from it. So that's the time we just refer everyone.
Yeah, to me, it's just about not stuffing around patients, and that's going to be a stuff around if you can't manage a complication. What part of dentistry, like what area, I'll start that again. So Mahia, like what area of dentistry do you feel is beyond your expertise? Like what don't you do?
For me, definitely root canal treatments just don't agree with me or my personality or my hands or whatever. It's been like that since dental school. Yeah. And that caused me so much anxiety. I would always see that appointment like a couple of days away, a big root canal on a molar, and I'd be like just dreading it. And when I got rid of it and sent it to someone I was working in a clinic at the time that had a root canal, kind of someone trained more advanced in it, and they just loved it. That's all he did. And I'd get sent back a perfectly done root canal. And I'd be just doing what I do really well, which is ceramics, restorative dentistry, kind of rebuilding teeth. That's what I really love. So I'd say root canal and complex surgery, difficult wisdom teeth, messy extractions, I never enjoyed that. But now I've got you, and I know you really love that kind of work. So what about you? Any procedures you don't really like to do?
Yes, for me, I do a lot of orthodontics, Invisalign, braces, but I limit it to adult teeth. If one thing that I feel is just too complex for my knowledge level is mixed dentition. So kids with baby teeth and adult teeth with problems developing, there's so many moving parts and there's so many things that can be done incorrectly. And for me, I really feel like if you're going to intervene orthodontically early, when there's primary teeth present and adult teeth, I really think it needs to be managed by a specialist who really knows what they're doing, you know. And that isn't every specialist as well. You know, a lot of specialists just wait until the adult teeth come through. But this early interceptive treatment, it can be effective, but it's tricky, and it's just something I won't touch.
Early, I mean, we studied together, and you did really well in uni, and you were top of the class. Did you ever consider just going down the specialist route?
I had to give it a really good thought straight after uni, because if you're going to do it, you got to decide early, and really gave it some thought, and thought about orthodontics, thought about oral surgery, and thought about periodontics as well. The problem is, I just feel like with the way technology is going, things are getting more simple. Okay, and the problem with specializing in one area is that's all you're going to do all day. You know, you're either going to be extracting teeth and placing implants all day, or just doing braces all day. And the problem is, most of it I felt that would be pretty boring, because what I love about dentistry is just dentistry, every aspect of dentistry. The other thing is, when you're just doing that specialty, you're just treating a small part of a case. Whereas a lot of our cases are really complex that we do, and they require orthodontics, they require implants, and they require crown and bridge work as well. And the ability to do all of that treatment on a single patient and not have to have them see 4 or 5 different clinicians, pay 4 or 5 different consult fees, and we're able to do a lot of that treatment much more affordably for patients, because we can offer it all in one place. And to me, doing everything in a case from start to finish and just having total control over it and just implementing like my vision completely, it's like the best part of the job, 100%. 100%. Mahia, was there ever a point after uni when you sort of thought, I might become a specialist, or have you always wanted to be a general dentist doing a variety of work?
I think for me, I actually wanted to just kind of create my own specialty and move into a style of dentistry that's kind of uniquely mine, that maybe you can't go to university or some institution to learn, but you can pick all these techniques and create it with your own style. And that was one of my first mentors, would always tell me, you know, got to find your own style of dentistry. So that really stuck with me, and I was like, how about I just create my own style and my own specialty? Yeah. And especially with a bit of gold, with the diamonds, I feel like that's my style.
Yeah, absolutely.
Yeah.
All right, guys, that wraps up another episode of the Dental Debrief. So thanks for joining us. Just a final thought I just want to put out there that I think whether you choose to be a general dentist and do a wide variety of work, or whether you want to focus on one specific area and become a specialist, like, it's cool either way. All that matters is that you love dentistry and you love what you're doing and you go in there every day and just do your absolute best.